My name's Ed Beesley. I'm the chiropractor here at South London Chiropractic in East Dulwich and Peckham. If you're living with pain, stiffness, or limited movement, it can be really hard to work out what to do, who to see, where to go to get better. So I'd like to share with you some information about the way that I work here in my practice in South London, so you can understand whether chiropractic care might be right for you. Whatever treatment you choose, the first step is always to understand exactly what's been going wrong. So in the first visit, we're going to dig into the detail of what's brought you here and ask some questions about any relevant medical history. We're then going to carry out a thorough and focused physical examination. This is going to help us to reach a diagnosis, but just as importantly, it's going to help us to understand the bigger picture of what's at the root of the problem. So let's say, for example, that you've come in with knee pain and you'd like to be able to run again. So we're going to diagnose the knee problem, but we're also going to put that in context of what's going on at the hips, the pelvis, the lower back, the ankles. Are there restrictions or areas of weakness which we need to address, or the knee pain is just going to keep coming back? That way, when we start treatment, we know that we're getting to the root of the problem. We're not just treating the injury or the symptoms, we're also treating anything else that would otherwise prevent a full recovery. And if we're happy that this is something that we can treat and you'd like to do so, we can usually start treatment on that first visit. There can be a lot of ground to cover in the first session, and you may have questions that occur to you later on. So if you decide that you do want to go ahead with a course of treatment, we'll set aside some time on the second visit to talk through everything again and set out a clear plan of exactly what we need to do and how long it's likely to take. As for how we treat, well, traditionally the main technique that chiropractors use that's different from any other profession is the chiropractic manipulation. This is where we use extremely specific, high velocity, but gentle movements to the joints of the body, particularly around the spine, to try and relieve pressure on the joints and the nerves and bring back movement. Now, we still use this technique a lot, but in modern day practice, most chiropractors, myself included, use a range of other techniques alongside spinal manipulation, including myofascial techniques like massage or trigger point therapy, or active rehab focused techniques like exercise, stretching, or nerve flossing. There are many different ways of getting great results. The most important thing is that we tailor the treatment to exactly what your body needs. I work with people of all ages and many different lifestyles. I see professional athletes, performers, office workers, business owners, carpenters. Whoever you are and whatever you do, there are likely to be things that you could do at home to help. So as we make progress, we're going to focus more and more on exercises and stretches. These will be things that are simple enough to stick with so that you can fit them in no matter how busy you are. If you're still not sure whether this sounds right for you and you're in two minds about whether to make an appointment, I'm always happy to arrange a free consultation over the phone so you can fill me in on what's going on and I can advise you on whether it's likely to be worth your while to make an appointment. And if you would like to go ahead, you can book yourself in here online. I'm based in a couple of locations around East Dulwich and Bellenden Road in Peckham, and I look forward to meeting you and helping you to move and feel better.